We start at the BRAINTEASER system with the demo of the clinical tool. This tool is used by the clinicians to enroll and follow the patients. We log in the system as a ALS doctor. Here we can see the main page with the list of patients already included in the study. Here we can follow up existing patients or include new participants. When we click on the New Patient button, we see a question that serves as a reminder for clinicians, asking if the informed consent has been signed. In case the answer is negative, the system does not allow continuing. Once confirmed that the patient has signed the informed consent, the system uploads the 5 forms that must be completed in order for the patient to use the system. This information is the minimum necessary to be able to use the patient app. As soon as the last form is submit, the one for the devices, the patient will receive the access code and a link to create a password in their email. As this process continues the same as in previous periods, we will skip it in this demo and return to the main page. Now, we are going to open a patient already included in the system. This first screen shows the pending tasks that doctors must perform, which especially at the beginning, is to complete the different questionnaires to provide all the initial information. These forms were removed from the enrollment process so as not to block the start of the patient's use of the patient app, allowing doctors to upload the information as it becomes available and thus avoiding wasting time. Now we move to the patient app. During this period, to minimize potential data loss, a verification mechanism was implemented. Each time the patient opens the app, it checks if the Bluetooth connection is turned. Then the patient must use the credentials provided to them, i.e. the access code received by email and the password created using the link contained in the same email. As the initial configuration is the same as in previous periods, we will skip it, and when we log in we will be taken directly to the initial screen. During this period, another mechanism was implemented to verify that the 2 applications necessary to synchronize the devices are installed on the phone. Otherwise, a message is displayed informing you that you need to install an app to sync the devices. For example, in this case the Garmin app is missing, and, when we click on the link, we are redirected to Google Play to install it. We can install it, and leave the installation in the background, and we enter the main menu of the app. On this screen, at the top, the patient's pending activities are displayed. We proceed to fill in the questionnaire that appears as pending, which in this case is the questionnaire about the weight. We fill it out and we will see later that it synchronizes with the portal and allows doctors to consult the information provided by patients through the app. After completing it, the system indicates that there are no more pending tasks, although they may remain according to the protocol, but it was decided that only 1 questionnaire per day should be requested to avoid overloading the patient. During this period, a new questionnaire, requested by WP8, has been included to try to match the gaps, if any, of the environmental quality sensor given to patients with the fixed sensors in the pilot cities. To do this, information is requested about the job, if the patient has one, and whether he or she spends more than 24 hours outside the home. This data refers to the last 30 days, and has a frequency of 1 questionnaire per month. To avoid any blockage if the patient does not remember the information and to allow patients not to provide information that they consider too private, the questionnaire includes an I don't know, I prefer not to answer to some relevant questions. During this period, the educational content has also been expanded, adding 3 categories, 1 for general advice and 2 for exercises. In addition to expanding the content, support videos have been incorporated into some exercises to make it easier for the patient to understand how to perform them correctly. Different contacts have also been added in the corresponding section, which vary depending on the patient's center and disease, and always include how to contact the follow-up unit, as well as other relevant contacts. Now we return to the clinical portal to see the synchronization of the data of the app and the rest of the information. Here we see the questionnaire that we have just filled out in the app. Let's now see the results of the artificial intelligence models integrated into the clinical portal. To do this, we use the patient with this access code. We are using a test server where we have copied the data of a real patient to avoid manipulating any type of data, but using this data allow us to obtain results from the AI models that are as realistic as possible. In the second tab, AI models, we observe 3 models integrated into the clinical portal. The first model allows us to know the patient's progression. In this case, being an ALS patient, there are 3 possible outcomes, death, non-invasive ventilation, NIV, and PEG. We can select the variable of interest and the dataset to be used, after which the service loads a graph showing the possible progression of the patient. The line represents the patient's progression over time, while the background of the graph is divided into 3 areas of different colors, representing different levels of risk over time. Below this graph are categorical variables, continuous variables, and the Shapley values. Next, we run the patient stratification model. In this model, it is not necessary to previously select any variable or dataset that we want to represent. If data is available, 2 results are displayed. Below each bar graph we can see the group to which the patient belongs and a series of categorical variables represented by colored bars, in which the variable that has the most saturated color, corresponding to the value of the patient. Finally, we show the prediction model of the ALSFRS-R values. This model allows the clinicians to select a date from which they want to obtain the prediction, using the data from the Garmin device from the 2 weeks prior to the chosen date. The result of the model shows a score for each of the 4 variables of the ALSFRS-R, with values between 0 and 1, with values close to 0 indicating a high confidence that there will be no deterioration, while values close to 1 indicate a high confidence of deterioration in the corresponding variable.